Okay, my name is Dr. Casey Call, and I am the Associate Director of Education at the Karen Purvis Institute of Child Development. And you are joining us for an information session on our graduate programs. We have a new online master's program in developmental trauma and a new online certificate program in developmental trauma and TBRI. So we are so happy that you have joined us today for this. And I wanted to let you know that I am recording this. So for those of us who couldn't join, they'll have access to it via our website. So, or if you need to go back and ask, remind yourself of anything, and we'll add these questions to our FAQ list as well. So thank you for being here. Many of you submitted questions through the registration page, and we appreciate that. And we have listed those questions and come up with answers for those. And so we'll be going over those. And then if you have additional questions, the Q&A is active um, on Zoom. So the Q&A is open as well. Um, so feel free to ask questions there. Okay, so we're going to go ahead and get started. First of all, I would like for Sarah Cronin, would you introduce yourself and tell about your role within the programs?
Yes, of course. Can you hear me?
Yes.
Okay. And I'm trying to multitask by admitting people at the same time. So
I can admit people while you're talking.
I'm trying to do both.
Yeah.
I'm Sarah Cronin. I am Student Programs Coordinator here at the KPICD. I've been here for a little over 10 years, and I am assisting Casey in the management of this new online program.
Excellent. Excellent, excellent. Thank you, Sarah. Okay, and I serve as the program director for our graduate and our undergraduate programs. So between the two of us, we will figure things out, um, along with help from the rest of our KPICD team. Okay, so let's get started. First of all, we are very excited to announce that we've been working on having an online program of submitting it and proposing it for many years, and for it to finally come into fruition feels like a dream. So we have heard needs from professionals and from people around the United States and around the world that said, I really want to come and do your developmental trauma program, but I can't move, or I can't uproot my family, or I can't leave my job. So that was kind of what motivated us to enter into the online learning space. So first of all, we have three different graduate programs, and I'll talk a little bit about each one of those, but know that all three programs are completely online and completely asynchronous. So you can work on the classwork and the assignments at your own time. There will be regular communication with the other students and with the instructors, but it's done at your time. Okay, whenever you can fit that into your schedule. There's not going to be any mandatory um, meetings or class times or anything like that. Okay, so all three programs are online and all three are asynchronous. The first program is the Masters of Science in Developmental Trauma. This is the program that we have had at the KPICD since 2016, and we are moving it to an online version. We've had an in-person cohort with between 4 to 6 students at a time, and it's been very successful as an in-person program, and we feel confident that moving it to an online program is going to be an even better fit for more people. So the master's program is a 30-hour program, and it consists of 10 classes. They're 3 hours each. It's designed to be a 2-year program, meaning you take 2 classes in the fall, 2 in the spring, 1 in the summer, the first year. And then the second year, same pattern, 2 classes in the fall, 2 classes in the spring, 1 in the summer. So that's how the master's program is designed. So you can finish it in 2 years. You start fall of year one, and then you finish at the end of summer year two. That's the online master's program, and it consists of courses such as trauma and relationships, which is a deep dive into attachment theory, the research surrounding attachment theory and interventions, especially TBRI. You have classes such as advanced neuroscience, where you take a deep dive into brain functioning and dysfunction according to the latest research and evaluation. You have classes such as advanced developmental psychology, where you look at different developmental theories and how those apply to typical development and to atypical development. You also have courses such as a interactive uh, oh gosh, I just forgot the name of it. It's IDA. Sarah, do you remember what the D is? Oh, interactive data analysis.
Data. It's
Thank you.
everything.
It's a statistics course where you learn how to not only compute but also interpret statistics for research and evaluation purposes. There are also a capstone course. The capstone course is required of all the master's students who are doing the 30-hour program. And the capstone, in the past, we've called it a treatise for our in-person students. But what the capstone is, it's really based on what your needs are. So if you are wanting to go to a PhD program or get really into pursue a professional path in research or evaluation, then for your capstone project, you might work on an evaluation project for the organization you currently work with, or you might help our research team at the KPICD with a research project that they're currently working on, or you may have an independent idea for a research project that you want to do. Let's say that's not your thing, and what you really need is you want to, in your current position, you need to design a way for maintaining fidelity to to TBRI, right? And how do I maintain staff wellness within a trauma-informed care environment? So your capstone project could be developing that plan of action and implementation that you are going to do, right? So it could be something that's really involved, that's something that you really need to do, or something that you want to do, or something that you aspire to do. So the capstone project is really meant to meet your needs depending on what they are. It could be research focused, it could be application focused, and it could also, it could be something that's going to fit your needs. So we have our 30-hour Masters of Science program, online asynchronous, 221 fall, spring, summer for 2 years. The second thing that we have is our graduate certificate program. This program is 9 hours, which is 3 classes, and it is designed to be one fall course, one spring course, one summer course. Okay, and then you get a graduate certificate. Then, if you decide, okay, I've dipped my toe into graduate education and I really enjoyed the classes and I really think I want to go on and get my master's, then those 3 classes can be applied towards your master's program. And then you would have the 21 hours left, right, to complete those. Or you can finish and be done and just do a graduate certificate in developmental trauma and TBRI. And that is there, I mean, there are many graduate certificate programs in colleges and universities. And so that would just be a graduate education, a graduate certificate from our College of Science and Engineering at TCU. And then our third program, which won't apply to most of you, is for our undergraduate TCU students. Those students who have majored in child development have the option to apply for a 4-1 program. That program, if they graduate with a degree in child development, they can stay for 1 extra year and complete their master's in developmental trauma. And so we've got a special program for them, and we are doing a information session on that program next week. So if it is something you're interested in, let me know. We really marketed it to our alumni and our current students. So, but if that's something that that you'd like information about, let me know. Okay, so those are our 3 programs. A couple of questions that were asked over and over again. One was about if I am already a TBRI practitioner, what there's a lot of questions around that. One is are there preference given for TBRI practitioners to get into the certificate program or the master's program? Of course, when we're evaluating applications, we look at them holistically. So, what is your current role? What's your motivation for seeking this opportunity? If you're already a TBRI practitioner, great. I don't know exactly what our rubric is going to be yet. We're not finished developing it, but experience working with TBRI, experience working with populations who've experienced trauma will all be bonuses. So that, I think that yes, it will be an advantage if you have the experience either in TBRI or working with populations who've experienced trauma. So another question around TBRI practitioner is what's the difference between the graduate programs and being a TBRI practitioner? And I say there's a lot. There's a lot of difference. The TBRI practitioner program is designed to equip professionals to practice TBRI, right? It's a few weeks of online work and then 1 week of intense training. So just in and that is very different because our graduate work is like weekly communication for 16 weeks for 2 years, right? 16-week semesters over 2 years. So we are going to be able to go deep into the research, deep into the evaluation, deep into the implementation, and deep into the practice of what does it mean to be trauma informed? What does current research say? What are best practices? And do a deeper dive than you're allowed, that we have the time or space to do at TBRI practitioner training. I think TBRI practitioner training does a really good job of immersing you in TBRI and trauma-informed care and giving you the tools that you need and equipping you to be able to go out and do it right then. I think the graduate program gives you a deeper dive into these concepts and ideas and prepares you for a lot more, for leading a team through trauma-informed care, through leading an organization through trauma-informed care. You'll understand the why and the how and the what to do at a deeper level. You'll get to learn in TBRI practitioner training, you get to learn from your TBRI mentors. In the graduate school program, you will be learning from TBRI mentors, from the KPICD staff, and from TBRI practitioners, and that are in our network. And a lot of that will be based on the needs of the students. What does this class need? What do the students want to do? What are their goals and outcomes, and what are they interested in? So those, if you know anything about TBRI, it's what's the need? We've got to figure out what the need is, and then we try to meet that need. And the same is for our graduate programs. So if your need is, I want to, pursue a PhD program, okay, well, then we're going to get you set up and give you assignments and give you opportunities to be able to do that. If your goal is, I want to become the trauma-informed leader and lead my system through, that this paradigm shift and be the administrator and leader and, the cheerleader, the head cheerleader for TBRI implementation, then we want to set you up in order to be able to do that, right? I think one of the advantages of our graduate program is that we have the KPICD team. So we have our outreach team who does training and consultation. We have our research team who does research and evaluation. We have our education team who our specialty is providing a deep dive around these concepts within an educational framework. And then we have our new resource team, which is developing materials and resources for our networks. And we have our operations team, which keeps us all up and running. So we have, as a student at TCU, you have a lot of advantages. One is that you have access to TCU resources, and the second is that you have access to KPICD resources as well. Let's see. Another couple of questions that we got many times was over the cost of the program. The cost of the program is set by TCU Board of Trustees, and it's based on tuition. So we did advocate and get approved for a 30% graduate tuition discount for all of our students, which we are very excited about. The current credit hour for graduate tuition is $2,145. So with 30% off of that, it comes to $1,500 per hour. So if you look at that for current prices, for the current certificate program of 9 hours, that comes to $13,500. And then for the current tuition rate for the master's program, it's a 30-hour program, and that comes to right about $45,000. So those are the costs. We have no say in reducing those further. We have tried, and that is we've done the best that we can on that. I will say, as far as opportunities for financial aid and scholarships, there are many. On the TCU graduate website, they have opportunities for specific, or the financial, sorry, not the graduate website. On the TCU Financial Aid and Scholarships website, there is a special section on there for graduate students in particular. So as far as applying for financial aid or scholarships, you would go directly through the TCU Financial Aid office. One thing that we will be doing is we will be offering 2 graduate assistantships. These in the beginning, I don't know if this will be this way all the time, but in the beginning, they will have to be in person until we get the program up and running. So if you are in the Fort Worth area and this is something that you're interested in, we'll have 2 graduate assistantships, and applications will come out for those into May, beginning of June. And those positions will have a stipend and also have tuition covered. Our graduate studies office provides the tuition dollars, and then we provide a stipend for those 2 positions. And those 2 positions will help us, Sarah and I, with the running of the program and with the administration of the program and with the like with the courses as well. All right, who is this program designed for? That was asked a couple of times. I think it's ideal for people who want to lead others in systems change, who want to help shift that paradigm to trauma-informed care, for those who want to pursue higher education. Please note that this program does not prepare you for a license. So that is something to keep in mind. That's something that I have frequent conversations with my undergraduate students about. That if you want a license, this program does not prepare you for that. So you would need. I have a lot of people who come to our program and then go to a license program, but just know that going in, it does not prepare you for a license. What electives are offered? So currently we are still developing our electives, and they will continue to be developed throughout the program as it's running based on the needs of the students. So some of the ones that we are developing now, one is a study abroad program. So if that's something you're interested in, we've been running undergraduate study abroad programs since 2016, I think. And we are proposing a study abroad program. This could look like, I'll give you an example. For our undergraduate program this year, we are going to Estonia and Finland, and we're going to be working with TBRI practitioners within Eastern Europe on how, on the cultural differences, on their barriers, on the successes they've had, and learn about their systems of care. So that could be a possible elective. Another one could be an internship opportunity. There were some questions about what do internship or research internships look like. They could look a lot of different ways. So it could be a special project that you're working on within your organization where you have a supervisor and a mentor. It could be an internship through some of our TBRI mentors or practitioners. An example that our undergraduate students do frequently is work at TBRI camps in different locations and different places around. You could also work with our research team or other TBRI practitioners or researchers who are conducting evaluation or research. Some other examples of electives of things that we're talking about are like more sector specific electives. So what does trauma-informed care look like within schools? What does trauma-informed care look like in juvenile justice or in child welfare? So those are being developed as well. So we have, we have a lot of goals and we're looking forward to the future, but right now we're just trying to get this first cohort up and running. And then we hope to develop in the future another certificate program that would be stackable, maybe in trauma-informed leadership or something like that. And then, just keep building on the opportunities that students have. So, TBRI practitioner training is not included in the program. That was one of the questions that we got asked. And another question that we were asked was, are there any required in-person meetings? We will offer an optional orientation prior to the beginning of the program in August here in Fort Worth at TCU. We're working out the dates and the details right now. But during this in-person orientation, like I said, it is optional. It's recommended if you can make it. If you can't, we will offer Zoom sessions for the preparation and record those as well. But the purpose of the orientation is to, one is to build relationships. One of the things that has been at the top of my mind and the top of all of our minds is, okay, go into a fully asynchronous online program. And we know the importance of relationships and connections. We are being very, very intentional about student connection and connecting with those of us at the KPICD and the instructors. So everything we're doing, we are really thinking about, okay, how can we make this more relational? How do we intentionally connect the students together, the cohort together, and also, our staff and faculty. So that's one of the things we're looking at. So the orientation, number one, is an opportunity for those of us who can to get together in person and build connections. It's also an opportunity for us to give you an orientation into what are the resources available at TCU. How do you use the library? How do you find articles? If you need accommodations for classes, who do you go to for that? We're also going to do a TCU Online is our learning management system. And so we will teach and get everybody up to speed on how do I do an online class? Maybe it's been a while since you've been in school, right? So like, what does that look like? How do I log on? How do I do a discussion board? Where do I find the syllabus? How do I turn in assignments? How do I get feedback? So we'll go through like a mini course that sets you up for what the online courses will be like. And then we'll do some, networking and relationship building, as well as do some fun things in Fort Worth. We'll also do a mini session on scientific reading and writing. And the orientation purpose and then the Zoom sessions that will be a part of those will be in order to get everybody kind of on common ground starting. Like, here's how I do an online course. Here's what scientific reading and writing looks like. Here's the resources that I have available to me. So that is the purpose of the orientation. Let's see. The three courses for the certificate are trauma and behavior, trauma and relationships, and I wrote this down. Oh, and an elective. So it'll be an elective that you can choose from. So it could be a study abroad program, it could be an internship, it could be a sector specific course, or it can be a class that we're offering that's required for our master's program that you just want to take. So advanced developmental psychology or advanced neuroscience. So it just has to be approved by your advisor. Okay. So I checked with our graduate director today to see what the qualifications were for applying to both the master's program and the graduate certificate program. And he said you have to have a bachelor's degree, but it can be in anything to apply to both the master's program and the certificate program. So there will not be any remedial classes that you have to take. That's kind of the purpose of our orientation. There will be professors and instructors will give you some background information to read if maybe you haven't had a big background in that. So you'll be able to kind of deep dive on what you want to and kind of, surface on the things that aren't as important to you. So you do not, so you have to have a bachelor's degree in order to apply to both programs. And, but it doesn't matter what it's in. We are not going to be looking at your undergraduate grades. Somebody asked about that. If you have if you have an undergraduate degree, that is a check mark for us. You get all your points on the rubric. Your experience and your motivation to do the programs are what's important to us. We have, so that's not going to be an issue. Um, let's see. Our neuroscience program is going to be, we're going to kind of start, if you haven't had neuroscience before, we'll start kind of in the middle and get everybody up to speed before we get into the advanced part of it. The starting capacity for the online program, we are going to accept up to 25 students for the first cohort. And that will be a combination of our 4-1 program and our master's program. And then we'll accept up to 10 students into the graduate certificate program this first year. So we're hoping to increase that, but we don't want to overwhelm anybody. And we want to make sure that we're doing everything really intentional and thoughtful. So, if you have a bachelor's degree in the Ukraine, yes, that is acceptable. Oh, one of the things another question that we were asked was about international students. We are part of an organization called SARA. I think that's what it's called, that recognizes there's like mutual agreements between countries to recognize degrees. And so what I would say is that you can live in any country and apply for the programs. But what you want to make sure and you want to double check is within your own country that they will recognize the graduate certificate or the master's degree. Because it's up to the country, your country of origin or the country that you're living in, whether or not they will recognize it. Most will, because TCU is accredited by multiple accrediting organizations. Most countries will, but I strongly encourage you to check on that. As far as time zone differences, it won't matter because it's online and asynchronous. And we do TCU. Another benefit of being in a graduate program here is that we have a TCU Center for International Studies that supports our international students. So that would be another resource. Sarah, what have I not answered?
Done a really good job uh, so far. Um, Talk a little bit about postgraduate like positions that people get with this type of masters.
Yeah, that's a great question. So I can tell you what we've had in the past with our current in-person developmental trauma program. So people who graduate from that program, it seems like they kind of take one or two routes. One route is they go on for further education. And so we have many students we have a student who's in our program right now who's going to occupational therapy school starting in the fall or in June, actually. And we have someone who graduated last year who's been doing international work with mothers in Tanzania. And so we have kind of this educational piece. We have a lot of students who have gone on to do PhDs in a lot of different areas, psychology, mostly education, more, and then a lot of students who will go do like an LPC or a LCSW degree because they decide, okay, I really want to work with people more in a therapeutic way, and so they go and get a license. The second route that people typically take is through advocacy or organizational, not, NGO work. So working for an NGO or a community agency, doing multiple things. So we've had one student or actually several students who've gone to work for MHMR Tarrant County, who have been family support specialists. Their role has been to do home visits and teach TBRI to families. They do it kind of on the preventative side. And so we've had several students who've done that. I have a couple of students who have gone to work for our early childhood intervention, some students who are working within administration and leadership in um, NGOs and nonprofits, really those that are designed to serve children and families. So a lot of different kinds of areas. Some education. We have an organization here in Fort Worth called Academy 4 that mentors fourth grade students in Fort Worth ISD. We have a student who is leading some of those programs. I'm doing it from a trauma-informed lens and also provides training for her fellow coworkers. We have another student who graduated who started her own nonprofit, Rooted Families, Rooted Communities. You may know of Melissa Burdett, and she is working with families who are fostering and adopting and really trying to equip them for success. And she's doing a lot of other things too. Through her organization. So it kind of varies. I would say the two, what do you do after you graduate? One would be like continue for further education, and the other one would be kind of leading the charge within your organization or within your area of bringing trauma-informed care and TBRI to either employees or families or people that you're serving. There is not a maximum age limit. You can be any age and apply to our program. The more experience and diverse student body that we get, I think will be in everyone's benefit.
Casey, one other question. Does it have to be completed within the 1 year or 2 year period of time?
Yeah. So we designed the model as a cohort model. So our students would be able to go through the program with people. There will be able to be exceptions made to that. So right now the program is a 2-year program. And if you're thinking, well, I could only handle one course at a time, I think we could make that happen. We would just need to map it out and figure that part out. I looked at that question earlier today and I had a class, and so I didn't have time to completely map it out, but I'm fairly positive we could make that work. So I think that we could, did I answer the question? Okay, I think we could make that work if you needed to stretch it out. If you needed to condense it, we couldn't make that work right now because we can only offer so many classes per semester. But I think if you needed to stretch it, we could work with you.
I feel like you've answered a lot of the questions.
Cool. Somebody asked about another degree from TCU in criminal justice. You may be in our 4-1 program, there are 3 specific courses that will transfer for our child development majors. I would have to look at your transcript. My initial thought is probably none of those courses would transfer. But there's a possibility that one could as an elective. So I would just need to look at your transcript. Let me look through my notes. Oh, somebody had asked about in-person classes. We will not be offering an in-person developmental trauma program, so the only opportunity will be online. And then
Casey, can you maybe go a little bit more into like research opportunities and what going to somebody's camp or what an internship kind of looks like?
mhm. Yeah, so research opportunities could include working. So we have a grant from SAMHSA. We're applying for another grant in conjunction with another university in Boston. Our research team is very active in research projects. And so if that's something that you're interested in, we would team you up with our research um, team, and they would work with you on, I don't know exactly what that would look like. We're not on that team, but it could look like, collecting data, analyzing data, setting up a project, just assisting them with one of the projects they're working on. They also do evaluation projects on trainings and TBRI implementation. So if that's something you're interested in, that could be a possibility. We also imagine reaching out to our TBRI networks and asking people, if you're in Indianapolis, asking people, okay, are you working on anything? Do you need a research assistant? Do you have a project that, our students could assist with or to help with? You could also do an independent research project. So that's what most of our students have done in the past in this program. So one of them was Kayla Rabb. She's currently a PhD student, but she's very interested in trauma-informed practices within law enforcement. And so one of the things that she did is she did a um, independent research project based on that. And so I'm trying to think of what data she collected. I can't remember what data. I think she did interviews and focus groups with law enforcement who had been trained and who had not been trained, and then kind of gathered that information and wrote about it and did a literature search on what had already been done and what were some of the barriers and all of that. And then for evaluation, we work with organizations all around the world who are evaluating their programs. And so I feel like there would be opportunities not only with our research team, but within our network too, or within your own organization that you're working with. If your agency wants to host interns, um, we will be reaching out. Yeah, you can reach out to me too. That would be amazing. If you're like, yes, I have this evaluation project I need help with, like, let's do it. And the cool thing is that our students will have access to our research team who's been doing this for a long time. So they'll have guidance and supervision. One thing about the applications, there are three separate applications. So there's one for the master's um, program. And then there is one for the graduate certificate program, and then another one for the 4-1 program. So make sure that when you're applying, you are applying at the right application. Applications opened on January 1st. They will close on April 1st, and we will make our decisions and get back with you by the beginning of May on acceptance. And then you'll start in August. I think we found the starting date like August 26th or something like that for next semester.
I think it's a little bit before that, but I can't recall.
Yeah, it's the 24th. Yeah.
Oh,
So
24.
the program will start on August 24th. Um, the application wasn't found when you tried after January 1st. Um, I'm not sure why. Hmm. I don't know. Try it again, and if you still can't get it, let us know. Um, You do not have to have a graduate clinical mental health degree from another school. Um, no, you just have to have an undergraduate degree, and it can be in any area. Um, I think I've gone over all of the notes that I wrote down. So we have been recording this. We will post this on our website. Also on our website, it's child.tcu.edu. Over on the left where it says graduate studies, you can go on that. And then there's an FAQ page at the bottom, the link to the application at the bottom of that page. Um, yeah, and somebody asked, will there ever be a PhD program? We hope so. That was Dr. Purvis's dream to have a online PhD program in developmental trauma, and we are about making her dreams come true here. So I have a feeling eventually we will have that, but we have to go one step at a time. So I'm hoping in the future that we have that. Um, any other questions? Sarah, is there anything that you want to ask or talk about?
No, not really. I mean, I think you're pretty comprehensive. Anyone's able to reach out with additional questions. I'm trying right now to get into the application and I don't remember my password, so I'm not having much success.
There's two other questions. When will the next certificate program start? So the certificate programs will start each August. So every fall semester we'll start a new cohort for the master's and for the graduate certificate program. The first two classes will be trauma and relationships and advanced developmental psychology. we will also offer a statistics class in the fall as well. So if you are um, interested in that, you could possibly do that instead.
Casey,
Mhm.
I think I'm off mute. I know you talked about this, but will you just real quick talk about the redundancy between the practitioner training and the course? I know you said this is a much deeper dive, but is there a lot of redundancy?
Okay, well, this question, I don't know. I always think about it because I've been to TBRI practitioner training like 1,000 times and I get something new
Mhm.
every time. And so my students will say, "Oh, we talked about this in my other class." Yeah. So I'm always like, to me, redundancy feels like deeper learning because depending on where I'm at, I'll take something away from it differently that at the time. Of course, there will be some redundancy because it's the same three principles and the same six strategies. Will we go over the attachment cycle? Yes. Will it be like 10 minutes in one of your classes or 15 minutes? Yes. But we're also going to read all of the things that went into developing that and all of the reasons why and around it. So we're going to go at a much deeper level. Are we going to talk about the 5 Bs of trauma? Yes. So yes, there will be redundancy, but we're also going to deep dive into, okay, how does it affect our brains? How does it affect our bodies? How does it affect our beliefs? What are the not only the how, but also like what can we do and how do we, so yes, there's going to be some redundancy, but I think it's an opportunity for me, it's an opportunity for learning at a deeper level and for getting I don't know, getting more information, deeper information, knowledge, talking about it more, and bringing something different from where you're at and what you've learned and what your experiences have been. So you might take something different away. All right. Any more questions? I just want y'all to know that I am so excited. I cannot wait for this program to start. I want to fast forward to August when we get to do orientation and meet everybody Zoom or in person. Um, and I'm thrilled. And if you have questions, feel free to reach out to Sarah or I. We are happy to answer them. And if we don't know them, we will find the answers for you. We are learning a lot too as we move towards an online program and an online certificate. So I see one last question. The classes for the certificate program are trauma and relationships, trauma and behavior, and an elective of your choice. So it just needs approval from your advisor, which for right now, that is me. All right. So thank you so much for joining us. If you have additional questions, please reach out. Thank you for your time today, and I hope you apply. Bye, everyone. Have a good afternoon.